Brianna, can you hear me?
Yes, I can.
I'm going to go ahead and get started because we've got a good critical mass here. But could you monitor the waiting room and let people in for me?
Ye- Yes, I can.
All right, thank you.
You're welcome.
Good afternoon, everyone. I hope everyone's having a great afternoon. It got dark all of a sudden. It looks like it's going to rain outside here in Columbus, Ohio. But welcome to the September Caucus meeting. I am John Stanford, State Director for the Children's Defense Fund Ohio, and I am your facilitator this afternoon. Today, we have a very important topic to discuss. According to Children's Defense Fund Ohio's Kids Count 2025 data report, Medicaid is literally the lifeline for over 1.4 million Ohio children. The Kids Count data also highlights the shared health experience that many youth across Ohio face every day, from its largest cities to its Appalachian communities. Children in both communities receive comparable levels of Medicaid support. The report found that 59.7% of children in Ohio's Appalachian region rely on Medicaid. The report also found that 60.1% of children in metropolitan areas across Ohio also rely on that program for their health care. This year, we have seen a number of changes to Medicaid at the state and federal levels that will potentially have an impact on children and their families. By the end of this discussion, we hope to provide you with information on the following. One, what is the current state of Medicaid use by our children in the state of Ohio? Two, what is the current state of Medicaid in the state of Ohio? And three, what is the potential impact of the state and federal changes on Ohio's children? Here to present information that will hopefully address those questions and many, many more are Bridget Harrison, Deputy Director of Strategic Initiatives with the Ohio Department of Medicaid, and Dwyer, Associate Research Professor at Georgetown University Center for Children and Families, McCourt School of Public Policy, and last but not least, Brian O'Rourke, who is the Healthcare Policy Analyst with Health Policy Institute of Ohio. For today's meeting, as always, please hold your questions until the end of the final presentation after Mr. O'Rourke makes his presentation. Then we will open the meeting up for questions from those in attendance. Okay, without any further delay, I will now turn the meeting over to Bridget Harrison, Deputy Director of Strategic Initiatives at the Ohio Department of Medicaid for her presentation. The floor is yours, Bridget.
Thanks, John, and thank you everyone for joining us for this conversation today. I know that many of the folks on this call spend their days trying to advance the health and wellness of Ohio's kids, and so I absolutely appreciate your attention as we dive into my favorite topic, Medicaid. Next slide, please. So John and company asked us to put together some slides to walk through some of the basics of Medicaid. As you know, and as John provided in his preamble, Medicaid provides support for many Ohioans, but specifically for the majority of kids in the state. And so thought we'd walk through kind of what makes up Medicaid, what do our structures look like, and how does Medicaid specifically serve children and families. Next slide, please. Okay, so as I said, it's important for us to walk through some of those foundational structures, including who do we serve, what services do we cover, what does managed care do, what does it look like, and how do we serve children and families. Next slide. So before we dive into a high-level overview, I thought I'd start with one of the most important basic concepts within the healthcare and Medicaid framework. Next slide. And that really is, what is the difference between Medicaid and Medicare? And I wanted to start here because these two programs are often conflated. And that makes sense. We're overseen by our federal partners at Health and Human Services, by the Center for Medicare and Medicaid Service. But fundamentally, these are two different programs. Medicaid is a state federal partnership that provides aid to poor or low income Ohioans or individuals with disabilities. This is a state-based partnership, whereas Medicare is a federal program that provides health insurance for those that are aged 65 and older, with some exceptions for folks who have disabilities or who are on Social Security. The the quick and easy way to think about this is that, or at least the quick phrasing that we use in the Medicaid space is that you aid the poor and you care for the elderly. So Medicaid is typically for low income, uh, some children and those with disabilities, and Medicare is for those who are 65 and older. Next slide. So, to dive more into the specifics of Medicaid, Medicaid, like Medicare, was created in 1965 by Congress to provide some health security for low income Americans. We're not looking too bad for 60 years old this year. And as we celebrate that 60th anniversary, we have quite a lot to be proud of. Medicaid is a joint federal and state program that provides health insurance coverage to millions of eligible Americans and specifically Ohioans across the country and the state. But what's important about Medicaid is that if you've seen one Medicaid program, you've seen one Medicaid program. The Medicaid program in Ohio is completely different from the one in Pennsylvania, West Virginia, Texas, California. We oversee our Medicaid program through the different authorities that are granted to us by our federal partners, as well as the authorities that are granted to us by our partners in the legislature. So, because we are fundamentally an insurance program, it's important to understand some of the financing mechanisms. And so, Medicaid is mostly financed through a mechanism called the FMAP, or the Federal Medicaid Assistance Percentage. And this is a mechanism where for every state dollar that is invested in Medicaid, additional federal dollars are brought down. And it can be oversimplified with this quick and easy graphic. In short, for every 35 cents of Ohio dollars that are put into Medicaid, we bring down 65 cents in federal dollars, creating that $1 of Medicaid spend. Now, that FMAP percentage and those cents on the dollar are going to look different if you're in a different state. Because again, how the state chooses to design its program is based on what its goals are, as well as the authorities that are given to it by their partners in the legislature, and how the Medicaid program leverages those federal authorities. Next slide, please. So, who do we serve? Well, basically, we cover a few different groups. There is one group of folks that are typically clustered together in a group that we call the ABD population, and that's the aged, which is folks over the age of 65, the blind, and those who are disabled. There are also a group of folks that are categorized as MAGI, which is short for Modified Adjusted Gross Income. And those are folks who qualify for Medicaid based on their income level. There are also some additional categories for kids under the age of 19, parents, their caretakers, foster kids, and the Group 8 population, which I'm sure you've heard a lot about and we'll probably talk about later in our discussion today. But what's important for you to take away is that more than half of Ohio's births are covered by Medicaid. We're responsible for a lot of our kids. And with that responsibility, we've created some programs to make sure that through the pregnancy and into birth, we're taking care of and creating incentives for mom and baby to be well taken care of, so that both can reach their potential. We also provide service for more than 1.3 million kids in our state. That includes kids who are in foster care, those children who may have developmental disabilities or complex behavioral health issues, as well as those children who are just living in lower income households. And through this program, we provide our Medicaid service through our managed care programs, which I'll go into in a little bit more detail here on the next slide, or next few slides. Okay, so what services are covered? So I know that Medicaid can seem like a black box. You think it's just a health insurance program that pays the bills, and it can kind of seem a little obtuse. Well, because we are a benefit program, we do have specific services that we're required to pay for. And so I wanted to be sure to include some of those, because each state, as I've said a few times, has the ability to determine some additional services beyond what is federally required. And so in general, the federal government will require that we cover inpatient services, outpatient services, as well as some of the screening and diagnostic services you see here. But where Ohio has differentiated itself is including services like telehealth, including services like dental services and vision, and with the acknowledgement that dental care can be closely linked to your overall physical health care. So just as an example, if a person has a severe cardiac issue, there are germs in your teeth that can affect your heart. And so before you go into a major cardiac surgery, for example, you have to go in and get a series of pretty intensive dental cleanings. And so including services like dental services can be preventative in the long term. And as we know, um, vision is really important and has been a priority of the governor as well. So next slide, please. As I said, Medicaid is structured through two different mechanisms: fee for service, which is how you think about paying for your groceries. You go to buy bread, you're charged $1 for the bread, and that is your fee for service. But managed care is a little bit different. Managed care is where we pay a contracted managed care company to help control some of the costs of service, and they build out important things like the doctors in your network, and help control the cost of the overall care. Next slide, please. So I'm running through this kind of quick. John gave me the few-minute warning. So I'm going to go through as quick as I can. Next slide, please. So at the start of his administration, Governor Dwyer charged Director Corcoran with transforming the Medicaid program to better meet the needs of Ohioans. And out of a series of conversations and stakeholder engagement activities, we created the Next Generation Managed Care Program, which carved out and reprocured a lot of Medicaid as it exists right now. Next slide. And here's just a snapshot of some of the really important work that we did to, again, make sure that we were listening to what providers needed and what patients needed. Next slide. And out of all of that stakeholder engagement, we identified these really important goals. Next slide. I'm running through it, John, I promise, to create this vision for managed care, wherein at the center of care delivery, we have a person, and we have wrapped around all of these systems around that single person to ensure that they receive the best care possible. Next slide, and we'll skip again one more. And so, how do we serve children and families? There are a few that are specific to Medicaid. One is Ohio Rise, which is a specialized behavioral health program for kids with complex needs. Another really important service that Medicaid provides is we have expanded some of the services that we pay for that are available in schools to make sure that kids have access to care in schools. We have some really important programs for paying for quality for folks who are delivering babies and helping our moms as they work through their maternity care. And then importantly, we also have our Outcomes Acceleration for Kids, which is a program that we use our managed care companies to partner with our kids ACOs across the state to improve quality for all of our kids across the state. And so that's a hyper simplified overview of our program in your slide deck that will be sent around after our conversation. There's a lot more resources, but don't want to stand in the way of some important conversation from my partners, Ann and Brian. So, John, I can turn it back over to you.
Thank you very much, Bridget. And I apologize, but we want to try and get all of this information in the hour that we have set up for the meeting. We did get one request, Bridget, from one of the guests. When Brian is done, if you could put back up the infographic of the next generation of managed care, so that the guests can see that one more time and maybe have questions. With that, we now have Ann from the Georgetown Center for Children and Families who will present next. Ann, the floor is yours.
Thanks, John. And similar to Bridget, I'm going to try and fit a lot of information into about 10 minutes here. But if we could pull up the slides, Brianna, whenever you get a chance, or maybe they're up and I'm not seeing them. Oh, there they are. Sorry, you can go back to the start. Thank you. So as John mentioned, I'm Ann Dwyer. I'm an associate research professor with the Georgetown University Center for Children and Families at the McCourt School of Public Policy. For those of you who may not be familiar with CCF, we are a nonpartisan policy and research center founded in 2005 with a mission to support access to high quality, comprehensive, and affordable health coverage for children and families across the country, really with a focus primarily on Medicaid and the Children's Health Insurance Program, also known as CHIP. So today I'll be talking about some of the recent federal changes related to Medicaid and CHIP and what that means for Ohio, in particular related to passage of HR 1. Next slide, please. However, before I jump in, I know we heard some great information about the role Medicaid plays for children in Ohio from Bridget. I also wanted to note, as we can see on this slide, just the various eligibility levels for Ohio's Medicaid program, and then the gold lines in the middle are relative to the US median, so you can get a sense of where Ohio compares to kind of the US median across the states. However, for today's purposes, I also wanted to highlight a really important statistic. So coming from a recent CCF report released just this month on child health coverage trends with state-by-state data. So every year, CCF examines data provided by the US Census Bureau on child health insurance rates across the country. And the most recent report looking at trends from 2022 to 2024 found that the rate of uninsured children increased nationally, with the rate of uninsured children in Ohio increasing from 4.5 to 5.6%. And unfortunately, as I'll talk about in more detail today, we also think these trends potentially could worsen in the years to come, in part due to some of the pressures on states that are coming in part from HR 1. So we'll have some work ahead of us to kind of do more to make sure that children have access to affordable coverage, healthcare coverage. Next slide, please. And before I walk through some of the impacts of HR 1 in Ohio, I wanted to highlight the rural Medicaid. Again, as Bridget mentioned, it's a state federal partnership program where the state picks up some of the tab and the federal government picks up the rest. The role it plays in federal financial support for state Medicaid programs like Ohio's. So nationally, Medicaid is the single largest source of federal funding to states. And according to our analysis at CCF, based off NASBO data, in fiscal year 2024, Medicaid accounted for nearly 70% of all federal funds for Ohio. So all of the federal funds going in Ohio in fiscal year 2024, Medicaid was accounting for almost 70%. So again, changes to federal Medicaid policy can have huge impacts on the state Medicaid program. Next slide, please. So let's get into HR 1. So on July 4th, President Trump signed HR 1 into law. It included a number of changes, including over 20 provisions impacting state Medicaid and CHIP programs, really with historical cuts to Medicaid and CHIP. So according to analyses by the Independent Congressional Budget Office, the bill cut spending on Medicaid by over $900 billion over the next decade, so over this 10-year window, and will have an anticipated reduction in individuals covered by Medicaid of 10 million. According to the Kaiser Family Foundation, which also put out some state level estimates, so the Congressional Budget Office, they just look at federal level data, they're independent federal entity. The Kaiser Family Foundation broke down some of that by state and put out some state level estimates. And they have an estimated impact of about a $33 billion cut to Ohio over the next decade in terms of Medicaid, federal dollars, and also estimated about 340,000 people losing coverage just in Ohio alone. And I'll just note that these impacts are just Medicaid from Medicaid. They do not account for changes to the marketplace or implications for the marketplace or private coverage should the enhanced premium tax credits not be extended by Congress, which is currently being debated, which would lead to millions more becoming uninsured, according to estimates. Next slide, please. So again, given our time today, I'm not going to go over every one of the 20 provisions related to Medicaid CHIP and HR 1, however, and how they impact Ohio, but I did want to provide some top line highlights. And then I'll also note, and I'll put a link when I'm done talking to this in the chat, we have a full explainer on our website in relative plain English, as much as you can when you're talking about Medicaid and CHIP federal policy, explaining every provision, and then with a timeline at the end of when these things go into effect. And we also have a tracker on our website of which provisions impact which states, so including states like Ohio. So I can put links to that in the chat at the end. But at a top line, I'll note a majority of the Medicaid cuts in HR 1 come from 4 areas. So provisions targeting coverage for expansion adults, so like work requirements, cost sharing requirements, more frequent redeterminations, provisions restricting immigrant coverage in Medicaid, provisions restricting provider taxes that many states, I think all states except one use, including Ohio, to support their Medicaid programs. And finally, provisions limiting state-directed payments, which many states, including Ohio, also use. Next slide, please. Other notable changes in the law include reductions to retroactive eligibility, as I mentioned, but also for non-expansion populations, more severe penalties for payment errors, and a 1-year exclusion of Planned Parenthood from Medicaid, including for preventive care services like contraceptive care and cancer screenings. So again, a number of major impacts on states across the country, including states like Ohio. And again, we have a great explainer on our website, and I'll throw that in the chat in a bit. Next slide, please. So I believe Brian, our next speaker, is going to talk about this in a bit more detail, but I did also want to note that in addition to the changes in HR 1 due to congressional action, we've also seen the administration make a number of changes to the Medicaid program and more than I have time to go over in detail today. However, I did want to note an important change of policy that came out of the administration this summer that impacts Ohio specifically. So in July, CMS issued a letter indicating that they would no longer be approving or plan to extend waivers with continuous eligibility provisions in them. So as shown on this map and also in a tracker we have on the CCF website on continuous eligibility, a number of states have been making progress to extend continuous eligibility specifically for children. Many states from birth to age 6 or some ages in between. For example, in Ohio, I know you're looking at birth through age 3. And we know this is a critical period of time for when it comes to children's access to coverage and their need of coverage for well child visits and screenings. And again, can be really important for getting kids ready for kindergarten. However, given this guidance from this administration, it does not appear that the administration will be approving any more continuous eligibility waivers for children moving forward. And again, there's a little little note and link to that letter on this slide if you want to read about that in more detail. Next slide, please. So I've spoken a lot about what's coming and some of the expected impacts of recent federal changes. So what can states and child health policy advocates do about it? And there's a lot on this slide, which I don't have time to cover in depth today, but I wanted to make sure to put here because I think John might be willing to, or I can also share a PDF of the slides after. So I just wanted to make sure you had the information. But as a top line here, educate, monitor, mitigate, right? Fact checking, story collection, engaging in implementation efforts around, for example, how the work requirements are operationalized will be critical in the coming months and years. I'll also note that there's currently a funding application out for states to access $50 billion in rural health funds. That's due in early November. So again, that's states make that application to the federal government, to HHS. I'll defer to Bridget on the specifics of that, but I believe Ohio's collecting some feedback from stakeholders until early October. I want to be clear, these funds will by no means make up for the cuts to Medicaid under HR 1, as we talked about. It's almost $1 trillion in cuts. But given the role that Medicaid plays in rural areas, and again, we have some great reports on Medicaid in rural areas, including state level data on the role Medicaid plays in rural areas in various states. Again, ensuring children and women of childbearing age who are often disproportionately rely on Medicaid in rural areas are part of any discussion when it comes to rural support will be an important consideration. Next slide, please. So with that, I will wrap it up and just note again, we have a lot of great resources on the CCF website, including Ohio-specific one-page fact sheets on Medicaid and the role it plays for children. On our website, we have a state data hub where you can find more information specifically on Medicaid in Ohio, including quality metrics. There's also a function in there if you're curious how Ohio compares to an Indiana or another neighboring state or another state across the country. We have a compare tool as well. So there's a lot of great resources on our website. And again, thank you to all of you for your interest in Medicaid, for your commitment to the program, and your commitment to ensuring children have access to high quality, affordable, comprehensive coverage. With that, I'm happy to turn it back to you, John.
Thank you, Anne. Thank you for a great presentation. And thank you again, Bridget, for a great presentation as well. Next, we have Brian O'Rourke from Health Policy Institute of Ohio. And with that, I will turn it over to you, Brian.
Awesome. Thank you, John. My name is Brian O'Rourke. I am a healthcare policy analyst at the Health Policy Institute of Ohio. And today I'm going to present some important components from the 2026-2027 Ohio budget related to Medicaid and impacts on children and families here in the state. Next slide. So just quickly about HPIO, we're an independent, nonpartisan organization, and our mission is to advance evidence-based policies that improve health, achieve equity, and lead to sustainable healthcare spending in Ohio. And I'll talk throughout this presentation about some of the work that we're doing on Medicaid right now and other changes to the healthcare system that are in the current policymaking environment. Next slide, please. And we're very grateful to receive core operating support from this group of funders on the slide. Next slide. So in my presentation today, I'm going to start by giving a little context surrounding the state budget and Medicaid in Ohio, just to make sure everyone's on the same page. Then I'm going to go through some important pieces of the state budget for Medicaid with a focus on how parents and children might be impacted going forward. And then last, I'm going to talk a little bit about potential consequences of these provisions and how everything intersects with major federal legislation that Anne covered in depth. Next slide. So the 2026-27 state budget included $22 billion for Medicaid for the upcoming fiscal year, and that includes federal funds that will be drawn down as well. Throughout the whole budget, Governor DeWine issued 67 vetoes, 5 of which were related to the Ohio Department of Medicaid's budget, and one that I'll highlight specifically later in this presentation. And I imagine most of us are already aware, and Bridget did a nice job covering how many children and parents are covered by Medicaid in Ohio. So over 1 million Ohio children receive health coverage through the program. Next slide. And most children on Medicaid are covered through this category called Covered Families and Children, or CFC. Some parents are also covered through this Medicaid category. But then for the last 11 years or so, there's also the Medicaid expansion category in Ohio, which covers even more adults, many of whom are parents. So a total of 700,000 Ohioans receive coverage through Medicaid expansion, though we don't know exactly how many of these are parents. And as important context for later, the federal government currently covers 90% of expenditures for the expansion population. So that's just a quick and basic overview of how many families receive Medicaid coverage. Next slide. So now getting into some of the important state budget provisions for Medicaid. Next slide. One component that I want to highlight quickly that Anne also talked about is continuous enrollment for young children. So Ohio already had a law requiring the Ohio Department of Medicaid to pursue a waiver to allow children to remain continuously enrolled in Medicaid through age 3. In this most recent budget, the state legislature attempted to essentially remove this requirement, but Governor DeWine vetoed the provision, meaning that ODM was going to move forward with getting this continuous enrollment waiver or submitting it to the federal government. And as we know from Anne's presentation, shortly after, the Centers for Medicare and Medicaid Services announced that they would no longer be approving these types of continuous enrollment waivers going forward. And the reason I want to highlight this is because it represented an important step towards ensuring that young children have consistent access to affordable health care and reducing what's been described as churn on and off Medicaid, which is associated with delays in receiving care at that really critical developmental age. So Ohio was on track for pursuing this policy, but it's no longer going to be possible due to those changes at the federal level. Next slide, please. The next piece I want to highlight is related to Medicaid expansion and the Medicaid expansion group that I described in the intro. So the state budget included what's been called a trigger law, where if the federal government ever reduced the match rate for the expansion population below 90%, which is what it's currently set at, then the Medicaid expansion category would essentially end in Ohio. And there were thoughts that the federal reconciliation bill would lower the match rate, but it did not, to be clear. However, it could happen anytime in the future, and if that were the case, then based off of the state budget, essentially ODM would have to transition people currently in Medicaid expansion off of that category or to different sources of insurance. Next slide. Like I mentioned, over 700,000 Ohioans are covered by Medicaid expansion, so this would have major impacts on parents and children. So many people covered by Medicaid expansion are parents, and not only would their coverage be at risk if Medicaid expansion went away in Ohio, but there's also the possibility that children could subsequently lose coverage as well, even though they're not directly covered by Medicaid expansion. So there's a lot of evidence in the research literature that when parents have Medicaid, they're more likely to get their children enrolled in Medicaid as well. So that's kind of an important linkage to how parents and broader families could be affected by this trigger law if there were changes to the match rate for this group in the future. Next slide. And then last, there were major financing and funding changes for Ohio Medicaid. So one sort of new funding source I want to highlight is that there was additional funding allocated to improve the health of low-income children in the state, with some specific earmarks focusing on access to dental and vision services for children. The total amounts did end up being a little lower than what the governor proposed initially. And then second, there was significant funding reductions for the Ohio Department of Medicaid in the final budget compared to the governor's proposed budget, to the amount of about $94 million less in fiscal year 2026 and $650 million less in fiscal year 2027. So the motivation behind these reductions was for ODM to increase efficiencies or potentially identify waste. And it's not currently clear what the consequences of these funding reductions will be, but they're of course happening alongside very large financing changes that are coming from the federal reconciliation bill, like Anne discussed. And there's also a current decision from the Ohio Supreme Court related to nursing home payments that could result in an even bigger funding shortfall in these upcoming years for the Ohio Medicaid program. Next slide. So looking forward to kind of discuss some high-level consequences. Next slide. As I mentioned, the Medicaid expansion trigger law means that future federal policy changes could lead to the elimination of this coverage group in Ohio. So this could mean that parents of lower income families lose their health coverage, and might mean risks for more children losing coverage as well if their parents no longer enroll them, even if they remain eligible through that different category or eligibility group. And without Medicaid coverage, many families will struggle to find alternative sources of insurance and could end up avoiding care due to high costs or being saddled with significant medical debt. And I had also highlighted some major funding and financing changes for Medicaid, which are occurring alongside significant Medicaid cuts at the federal level. So the state will need to respond to these losses, and without a new source of funding, might have to consider some options, which would include reducing reimbursement rates to providers, eliminating optional Medicaid services that the state currently covers, like prescription drugs, dental care, and many mental health treatments, or potentially cutting specific eligibility groups. And each of these avenues would have different implications for healthcare access and affordability amongst Ohio families and children. Next slide. And so my last thing is just in light of many changes that we've discussed today, HPIO has been closely following these policy changes with a particular focus on Medicaid. So we've recently released briefs on how the federal reconciliation bill impacts healthcare affordability in the state. And we also conducted a study looking at the sort of benefits and impacts of Medicaid expansion in Ohio, as well as major consequences if it were to be eliminated in the coming years in the state. And there's a lot more work coming, including next week, an examination of upcoming Medicaid work requirements that some of you might be thinking about. Next slide. And so if you want to stay connected with us, you can sign up for our mailing page. I gave some of the resources there to sign up, and certainly feel free to reach out to me if you have any questions. And that's it. Thank you very much.
Again, thank you, Bridget. Thank you, Ann, and thank you, Brian. During your presentation, Bridget, one of our guests asked that you put the managed care slide back up. So, Brianna, if you can go back to that slide. And for that person, if you have a specific question related to that slide, when Brianna brings it back up, you can ask that question at that time. I think it was the infographic that the person was interested in, Brianna.
Okay.
Yeah, I think it was slide 14. That's helpful.
This one?
I think that's the one.
Yeah.
So is there a question related, or just wanted to see this one again? Uh, the person says, this is perfect. Thank you. All right, you're welcome. So real quick, everyone, the all of the slides that you briefly saw today will be made available to everyone on the Ohio Legislative Children's Caucus website. And I put that web address in the chat. It is ohiochildrenscaucus.org. Again, ohiochildrenscaucus.org. The video will also be made available on the website as well. It probably give us maybe a day or two to get that information uploaded for you. And I think lastly, we're going to try our best to also add the links that have been shared in the chat on that web page as well. Are there any questions from members that have listened to the presentations today?
Looks like one just came in the chat, John, related to HR1.
Okay, thank you. The question is, are there any estimates on how many children specifically would lose Medicaid coverage from the changes to HR1?
Yeah, so I'm happy. Oh, Bridget, I don't know if you all have done, you want to take the lead. I would defer to the state always. You know, you could.
So we don't have projections that are population specific. I think that part of the challenge of this year is the timing of both our state budget alongside the federal House Resolution 1. Typically, these processes don't align, but this year it did. So we are currently unwrapping the onion as it relates to HR 1 and understanding the cascade of impact on population there. And then we have the important work of lining it up to our state budget. And so we don't have a specific estimate for you today.
All right. Thank you, Bridget. Did you want to add anything to that, Ann, or
Yeah,
since you
I was just
chimed
gonna
in?
say, the I don't know right now that we've seen child level coverage impacts. I think folks are trying to analyze that now. The Congressional Budget Office just put out overall impacts. At one point in one of their estimates, they did have from one of the changes potential child impacts, but they didn't have overall the bill. So definitely, John, we work with CDF Ohio, and we'll happy to flag that resource for you should it come out. I think groups are trying to look at that. I would just note a lot of this is going to be about implementation. Children are more likely to be covered if their parents are covered, how the work requirements are implemented, how 6-month redeterminations for the expansion group are implemented. There's obviously chilling effects for families who are eligible, but maybe because of their immigration status, or there's changes for legal residents that are legal permanent residents and other groups that are not full citizens but are legally present. They change some of the qualifications. So again, a lot of it is going to be in the details of how some of this is rolled out as well. And so it could vary state to state, as Bridget was.
And I did
Thank you.
see there was one group, Men at Health, that does a lot of healthcare work, and they did do some modeling that estimated 321,000 Ohioans would lose coverage over the next 10 years. I'll paste the link to that. It's just something I've seen that's been put out there that does do state by state financial estimates, but I completely agree that it's totally dependent on implementation and guidance that hasn't even been released yet.
And Kaiser Family Foundation, I'll put the link that I mentioned. Their estimates has around similar numbers, but it's across all populations. I don't believe that they broke it out by like adults versus children.
Okay, thank you, Bridget. Thank you, Ann, and thank you, Brian, for that response. There was a question about the effective dates, and Ann has already responded with a link to an appendix that provides effective dates. So if you are also wondering about effective dates related to HR 1, please check out the link that's in the chat from Ann. Next question. For the Medicaid cuts in the state budget, were those cuts just GRF versus including federal match also?
That should be just GRF.
Okay. Any other
But
questions? Oh, go ahead.
I would just note that our ability to use general revenue fund impacts our ability to draw down federal funds. And
Yep.
so cuts to the state share impact federal share.
Thank you, Brian. Thank you, Bridget. Any other questions? What other cuts in HR 1 would impact health of children with disabilities, particularly community and home care services?
That's a really great question, Marla. I think that, again, we're kind of still unwinding the Medicaid specific impact. Where I think your question is getting to is HR 1, and getting to, but also way out of my breadth of knowledge, is that HR 1 likely also had changes to um, uh, the structures of organizations like SAMHSA and HRSA, and some of those community living and waiver support services that are not always Medicaid funded. And so I don't have an answer for you outside of the Medicaid space.
Thank you, Bridget. Next question. Can you talk about the increase in HR1 to HCBS waivers?
Sorry, Rachel, I don't have specifics to share with you on that.
Okay, thank you. Next question. Is there a concern that
Sorry,
Medicaid for...
John.
Go ahead.
John, I just wanted to note, I put in the chat, I think similar to, the general estimates is there haven't been a lot of kind of direct estimates on the impact of HCBS waivers and other waivers. I think I put a link to the chat to kind of talk about it's going to be more potentially the indirect impact of states facing intense budget pressures because things like provider taxes and state directed payments and these other mechanisms that they employ to support their Medicaid programs with their state dollars have now been reduced. And so it's going to put intense pressure on the state Medicaid budget at large. And historically, it's often HCBS services that are some of the first on the chopping block. Again, this is just historical, hopefully not moving forward, but I want to just put that context of some of this, again, will be implementation, how the states are responding to these budget pressures. Again, the HR1 isn't necessarily you have to cut this one part of the program. There are some provisions that are like that, but by and large, it is shifting some very difficult decisions to the state to have to decide how they're going to allocate these cuts. And that's why the education and the mitigation and the documentation is going to be so important as you all are thinking about working with your state to really minimize and mitigate the impact of these cuts to the extent you can. So put a link to that Health Affairs article in the chat if folks are interested in how historically this has played out.
Thank you.
And I would just reiterate something that Ann and Brian have said. Implementation for all of the changes is really critical here. And a lot of the provisions in House Resolution 1, we keep reminding ourselves that they're not self-actualizing. We do have to await a lot of guidance from our partners at the Centers for Medicare and Medicaid Service.
Thank you. Thank you for that reminder. That's a very important reminder for everyone. Next question. Is there concern that Medicaid for schools will be affected for reimbursements to schools in Ohio?
So we included the increase of services that was agreed to during the last budget in our baseline for this budget. And so at this point, we are not anticipating an effect, but as I said, that is based on some of my earlier comments where we're still unbraiding some of the challenges that we have from House Resolution 1, as well as some of the state budget dynamics that we're unfolding now.
Thank you, Bridget. Next question. What programs are there to help families re-enroll for the 0 to 3 age range that won't have access to continuous enrollment?
So I just want to make sure that I'm precise here. If a family and a child are eligible for Medicaid, they can re-enroll and go through and I hate to use like the Medicaid phrasing here, but the ex parte process, which is an automatic process where we use IT systems to verify information like income level and that kind of stuff. So that will remain. But I think that what we're talking about is the optional eligibility category that is separate from that dynamic process. So if there is a family or a child and youth aged 0 to 3 that are not eligible through that existing category, those folks would have to go through the traditional either marketplace process or work through their employer.
Thank you, Bridget, for that response. Are there any more questions? We have a couple more minutes left in the meeting. Okay. Well, thank you all very much for joining us this afternoon. Thank you, Bridget Harrison, Brian O'Rourke, and Ann Dwyer. I'm sorry. One more question just popped up. What kinds of potential impacts do you see to IHBT and Ohio Rise type services?
So, thanks for that question, Gabriella. So for the folks who aren't as familiar, Ohio Rise is that specialized managed care program for children with complex behavioral health needs. And that is a partnership with Aetna, who's the managed care operator for that program. As a part of Ohio Rise, we offer a service called IHBT, which is an intensive home-based treatment where a behavioral health provider can go into the home to help de-escalate situations and provide ongoing therapeutic needs to a youth and their family. Right now, we're not anticipating any changes. One of the values of using a managed care program or managed care as a tool is because of how we do our contractual and capitated relationship with them. There is some flexibility that they can absorb. But that being said, we're not anticipating, as I said, any significant changes with rates as of September 22nd at 3:22 p.m. as we are still unbraiding a lot of the federal and state budget dynamics.
Thank you, Bridget. One more chance for questions. Okay, again, thank you, Bridget. Thank you, Brian, and thank you, Ann, for your presentations and also for the responses to the questions. We are back to having this meeting. So the next meeting will be in October. In October, we're going to focus on education support programs such as school-based health clinics, universal school meals, and and hopefully be able to share information on what is the impact of those programs on the academic performance of students. And then in the month of November, we are hoping to have this meeting in person. And as a part of that in-person meeting, we would hopefully be able to pull together a meeting on the opioid crisis here in the state of Ohio and what is going on with that issue. So thank you all very much for joining us this afternoon. Again, the recording and the slide decks, and we're going to also definitely try and get the links on the webpage as well. Can be found at the Children's Caucus webpage. If you just Google Ohio Legislative Children's Caucus, you'll be able to find the link to the webpage. Thank you again, and you all have a great rest of your afternoon and try and stay dry as you make your way home. Take care, everyone.